Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: what is Xylazine Tranq? Xylazine, the animal sedative known as Tranq, is a deadly addictive global drug. The shocking truth about veterinary medicine dubbed Tranq is that it wreaks havoc on the human body. Initially intended for animals, Xylazine has unleashed a surge in overdose deaths among humans. With an alarming rise of 1,127% in xylazine-related overdoses between 2020 and 2021 in some areas of the United States. It is evident that this drug demands immediate attention and action. In a recent update, the U.S. administration has classified xylazine as an emerging threat, recognizing its pivotal role in the unprecedented spike of overdoses and fatalities. But what exactly is Tranq, and what do you need to be aware of? We reveal the crucial details of this dangerous emerging zombie drug and the tremendous damage it creates for its users. Where does xylazine come from? Xylazine is a synthetic compound that is manufactured in laboratories. It is not derived from any natural source. The production of xylazine involves chemical synthesis, where the specific molecular structure of the drug is created through various chemical reactions and processes. The synthesized xylazine is then formulated into different pharmaceutical preparations for veterinary use, such as xylazine injection solutions or oral formulations. Is xylazine a controlled substance? Yes, xylazine is a controlled substance. Xylazine controlled substance is classified as a Schedule IV controlled substance in the United States, indicating a recognized potential for abuse, leading to physical or psychological dependence if misused. Its possession, distribution, and use are regulated by law. Xylazine in humans. What is xylazine used for in humans? Xylazine human use is dangerous. There are no approved xylazine uses for persons. Instead, veterinarians employ xylazine as a sedative, anesthetic, tranquilizer, muscle relaxant, and analgesic to ease surgical operations, ensure safe handling, and simplify animal diagnostic tests only for animals. It includes xylazine horse sedatives, horse Tranq, and for others like dogs and cattle. Xylazine side effects in humans. Drugs with traces of Tranq can have harmful adverse effects if you overdose. In extreme circumstances, an overdose might result in death. An opioid overdose and Tranq exposure might have highly similar symptoms. It may consist of the following: slowing down of the central nervous system, sedation, slow breathing, low blood pressure, slow heart rate, slowed wound healing, frequent, persistent, or worsening skin infections, eye problems like small pupils, high blood sugar, drowsiness, amnesia, severe, painful skin ulcers and abscesses. Tranq injections frequently result in severe skin ulcers, but the gashes may appear on a different body area depending on where you use Tranq to pierce your skin. Xylazine skin ulcers. When accidental exposure or improper handling occurs, xylazine may cause skin irritation or allergic reactions. Avoiding direct skin contact with xylazine and taking appropriate safety precautions when handling the substance are recommended. If you suspect skin irritation or have any concerns, it is best to seek medical advice. There is limited information available regarding xylazine directly causing skin ulcers. Skin ulcers can have various causes, such as infections, poor circulation, or underlying medical conditions. What does xylazine look like? You may have heard of a new deadly substance that has appeared in the illicit drug market as America's opioid crisis persists. The non-opioid sedative is the analgesic drug xylazine. Xylazine drugs, referred to as Tranqs, are frequently combined with adulterated addictive opioid drugs like heroin, fentanyl, and cocaine. Doctors advise using the opioid overdose reversal drug naloxone in case of a suspected xylazine overdose. Naloxone, however, does not address the effect of xylazine on respiration because it is not an opioid. As a result, researchers are worried that the predominance of xylazine in the illicit opioid supply may reduce the effectiveness of naloxone in treating some overdoses. A suspected overdose should always be reported to emergency medical personnel. There is no xylazine antidote. Human xylazine overdose has no known cure. Thus, xylazine reversal supportive supervision is still the cornerstone of care. The ability of naloxone to reverse xylazine overdose has received conflicting findings. Or reaction to naloxone raises the possibility of concurrent xylazine or another non-opioid intake. Since xylazine and opioids are frequently combined, naloxone could be utilized to alleviate the symptoms of opioid use. Most of the time, Tranq, discovered on the streets, is combined with heroin, fentanyl, or cocaine to intensify or change the effects of the drug. It has a comparable euphoric or high effect to opioids. The drug is known as speedball when mixed with heroin and cocaine. In the United States, it is also known as tranq dope or sleep cut, in addition to zombie dope or tranq. Individuals who consume this tainted substance enter their bloodstream in a variety of ways, including smoking, snorting, injecting, swallowing. Inhaling. Xylazine can also be detected in small amounts in other medications. Benzodiazepines, alcohol, gabapentin, methadone, and prescription opioids might all fall within this category. Xylazine is used in veterinary medicine and should only be used under the guidance of a healthcare professional. However, if someone has been misusing or abusing xylazine and suddenly stops its use, they may experience withdrawal symptoms. Xylazine withdrawal symptoms can vary based on the individual and the extent of their xylazine use. Here are some potential withdrawal symptoms. Anxiety, insomnia, increased blood pressure, sweating and chills, muscle aches and pains, gastrointestinal distress. If someone has ingested or been exposed to an overdose of xylazine, they may experience the following symptoms: central nervous system depression. Xylazine overdose can result in profound sedation and loss of consciousness. The affected individual may appear tired or confused and may have slurred speech. Respiratory depression. Xylazine can slow breathing, leading to shallow and slow respirations. Hypotension. Xylazine overdose can cause a significant drop in blood pressure, resulting in dizziness, lightheadedness, and potential fainting. Bradycardia. Xylazine can slow down the heart rate, causing bradycardia. This can manifest as a slow pulse and feelings of palpitations or irregular heartbeats. Seizures. While rare, xylazine overdose can lead to seizures in some individuals. Seizures are a serious medical emergency and require immediate medical attention. Hypothermia. Xylazine can lower body temperature, leading to hypothermia. The affected person may experience uncontrollable shivering, cold and pale skin, and difficulty warming up. If you suspect a xylazine overdose in yourself or someone else, it is crucial to seek immediate medical help. Contact emergency services or the nearest poison control center for further guidance on managing the situation until professional help arrives. Please call We Level Up immediately to learn how our detox and addiction treatment program will help you overcome your Tranq addiction. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.